Yep, Jim Bombassi, Nutmeg Consulting. Was a service provider for about 11, close to 11 years. Was part of a 150 bed PSH project. We had federal grants, state grants, municipal grants, things like that. So was on the data entry side even pre-HMIS, and then when HMIS came along in '04, obviously had some responsibilities with data entry there. Then came over to Nutmeg, who does the HMIS admin for Connecticut. I've been with them for a little over 10 years now. Have been dealing primarily with the HMIS side of things, trainings, obviously, and other consulting around the country for uh, agency level projects as well as state level projects when it comes to the reports, APRs, SPM, LSA, all those fun acronyms out there. Happy to be here to walk through some of the elements of HMIS and some of the things that are tricky and challenging for just about anybody that uses HMIS. The categories or topics we're going to talk about today do trip up a lot of us, me included. I always have to refresh myself on a lot of these nuances. So if you are on this call and it's something that you either struggle with or you find challenging, you're in good company because a lot of people do. So.
Thank you so much, Jim. And now you should be able to share your screen.
Yeah. What I'm going to do, just real quick, I'm going to turn my camera off while I go through the training, just so I avoid any bandwidth interruption. Just give me 1 second to swap to my headset. Be back in 1 sec. Okay, can everybody hear me okay?
Yes, we can hear you.
Okay,
Yes.
great. So I'm actually using my son's gaming headset, one of his gifts from this past Christmas. It's coming in handy. I get to use it as well. All right, I'm going to share my screen. So what you're seeing is I have the test client up in HMIS right now. But first, I just want to walk through the agenda and the PowerPoint to talk about the things that we'll touch on. And certainly, if you have questions at any time during the presentation, feel free to type them in the chat, and we can, if they're something that we can deal with immediately, then we will. If it's a larger question, then we could certainly save that to the end for a more detailed discussion. But some of the things that Henid and Sherry have talked to us about are things like the family dynamics with Caseworthy, editing data in Caseworthy, and also the one-time fields and some of those air quotes vital assessments that are in HMIS that seem to have a lot of different triggers and especially for APRs and other reports like that, where if you don't have it, it seems to, does cause some issues with the data and the reporting. So the first area that we'll cover are the family dynamics, and the items would be, so just a couple quick things on the family member versus enrollment. I did want to talk about this briefly. So family member, just for clarity, this is when someone is added to or is part of a family in HMIS. This is not the enrollment in the program. So just because somebody is in a family doesn't mean they're part of an enrollment. And then the enrollment is when the head of household or other members are added to an actual program enrollment, meaning your program, whatever your program name happens to be in HMIS, they've been added to that program with a start date. But they first have to be part of a family in order to be part of that enrollment. And we're going to talk about that sequence a little bit because there are circumstances where an enrollment happens, but a family member is missing, and how to get them attached to that, not only to that family, but also to that enrollment. And then, of course, when somebody may leave a family or leave an enrollment, what to do in those circumstances. As you can see, there's some guides that we've provided. So there's a guide on how to add the family members during the actual workflow, adding a family member because they entered the family at a later date, or they were just missed during the workflow. You just forgot to enter them. Not a big deal, easy to fix. Adding a family member to an existing enrollment because they enrollment at, again, as a later date. Oh, did that one already? Sorry. I think I did that one twice. Let me get that one out of there. Exiting a family member from the enrollment while not editing the enrollment for the other member. So what's meant there is the person's leaving, but you want to leave the enrollment intact. Just one member's going, how to do that. And then, of course, removing a family member from the family because they left the family. Now, Henny and I discussed this actually briefly before the call, and we're going to talk about this a little bit because with HMIS and based on HUD guidance, a person can be in more than one family. The real trigger for any client record is where they're enrolled. So you don't actually have to exit somebody from a family just because they've exited the enrollment. Um, and the reason for that is that they may re-enter the family at a later date. So there's no harm in leaving them in the family. It's really the enrollment that is what carries their data to a report. Again, we'll talk about that in the nuance there that just because somebody's exiting from an enrollment that the other families are staying in does not also mean that you have to remove them from the family. Okay. So some of the other categories we'll get into is editing data. We'll jump to those after. I just want to start by covering the adding the family member during an enrollment. And we're actually just going to do one. I'll just jump in and we'll do, we're just going to add a client and a family member to an enrollment through the HMIS intake. And don't worry, I'll delete all this test data after we're done with the training. So we're just going to do a test. I'm actually going to use my head of household here. I'm going to use their record as our test enrollment. And then I'm going to check for duplicates as always. So as I do this enrollment, the system should hopefully find my client. And we'll let the little bird hop around there until the data comes up. And when the system does find the client, obviously we're going to select them. We want to use this as a new client as infrequently as possible. And here they do, they found them here, so I'm going to select them. And obviously it's going to pull in all the data that the system has on this particular client. Okay, so this is my head of household. I've checked for dupes, the system found them. Now I'm going to save and move on from, oops, sorry, I have to verify address. I forgot you all have that here. We don't have that in Connecticut. And then I'm going to save and move forward. And now, so here's the add family member screen. So what's important here is the system found my client, and then it found historically that this particular household, this is my client here, has historically been enrolled with their 10-year-old child. Now, if the 10-year-old child is no longer with this particular household, that's fine. You can actually uncheck them at this, let me do it there. You can leave them here at this point. You just won't check them in when you get to the enrollment screen. So again, nothing you really have to do here. If the child is still with the household or without the household, doesn't matter. It's just telling you that this is, how this person has historically been enrolled. When you get to the program enrollment screen, is you're going to have the opportunity to include them in the enrollment or exclude them from the enrollment. You can also add other members here. So this is that screen that some people miss where the screen pops up, they reflexively hit save, and they've just missed their opportunity to add a family member. So in this case, we're going to add another family member here. We're going to say maybe there's an adult child, for example, maybe that joined the household. So I'm going to just put in their info. Going to check for duplicates. We also got rid of this bird because people got tired of watching it hop around. And as the system looks to see if this client's here, then if there's data there, it'll populate. And obviously it's a test client, so there is nothing. So I'm just going to say this is a new client here, but 99% of the time, the system's going to find the person for you. I'm going to just fill in, I'm going to say no to that, put in their date of birth. And we'll say 2012, we'll make them a child. And just throw in some basic data here. And child, and then you're done. So you've added this child to the household, okay, to this family. So now the next time this head of household is enrolled in a program, it'll show that there's historically been 2 family members with that person. Again, all it is really is informational. You do not have to add that person or any of them to the enrollment when the enrollment screen comes up. And we're going to go through that as soon as we assign the program. I'm actually going to backdate a little bit here just to give us some room and to show some pitfalls that happen with the date you're actually enrolling somebody versus the date their enrollment started. So today's 2/8, the system defaults to 2/8, but my client's program enrollment start date is 1/15. So just make sure you're always checking your dates as you move along. And the project's open, so we're fine there. And then we'll just select an enrollment. We'll go with, let's see, is there one? I'll just do homeless prevention for now. That's fine. And then once you have that, then you go ahead and hit save. You could add a case manager there if you prefer to, but you can always do that after the fact as well. Okay, so here we are at the enrollment step. This is where you have the control to add the other family members to the existing enrollment. If they all belong there, if they're all enrolling in the program with the head of household, you can check them. But if one of them is not supposed to be there, let's say when that family member table came up, there were two family members there, and one of them isn't going to be part of this enrollment. That's perfectly fine. You don't have to check them, and that will keep them from being assigned an enrollment. They'll still historically be associated with the family, but they are not going to be enrolled into your program. Okay. In this case, though, I'm going to have everybody be enrolled. Now, again, the next hazard. The head of household is going to get the start date that you provided when you did the program start date. The members are going to default to today's date. So just make sure if they actually came in on 1/15 with the head of household that you adjust those. Okay. Now, there are circumstances where people won't be enrolling with the head of household. That wouldn't be done here. That would be something where a household member comes in after the enrollment. But if you're doing an enrollment here and you're bringing these members in, you're going to want their start date to be the same as the head of household. And just open up their exits. Okay, and you can see it's identifying them as children. And we're going to save. Okay, so now it's going to launch into the universal assessment, the HUD program assessment, so on and so forth. I'm not going to go through all of these. Most of you are pretty well versed in this. What I do want to just point out is, which it's not all that obvious at the top of the screen, but just a note that it's going to tell you which client record it's looking at. And this is obviously important because that is not well defined. This should be larger, and that's something Caseworthy is, I think, should fix because it should be very obvious to the user which client record they're in. So it's very small up here, but this is my head of household, so I have to provide the head of household data. After I provide the head of household data and save, then it's going to be the child. The next child will come up here, and then the next child. So why this is important, especially when you're dealing with larger families, obviously you want to know which client record you're in, so you supply the proper data there. This is a tripping point for a lot of users, especially that deal with larger families, because it's really just, again, it should be larger. This should be a banner across the top of the screen that, the name of the client, so it's very clear. But for now, I'm not going to go through all the assessment questions. I'm actually going to save progress, and I'm going to close. And, oh, okay, there we go. And this is just going to leave my assessment in pending status, or my enrollment in pending status, not a big deal. But for the other demonstration we're going to do here today, this is as far as we need this to look. As we talk about the family dynamics. Okay, so what we've done, we're going to look at the left side menu here. We have our head of household. We have our test child that was originally enrolled or part of the household before the enrollment. And then we had that new child that we added to the household and to the enrollment. So you see now everybody is here. Now, let's go back to our PowerPoint. So that was adding the family member to the household during the enrollment. Okay, so there's also adding a family because they entered at a later date, or you just simply forgot to add them. So we've got some guides for you for that. And let me grab that one. I think that's the adding during the workflow. Okay, and this is adding a family and adding them to the family, and we'll also talk about adding them to the enrollment as well, because there's steps that you're probably going to have to do in concert. If you have to add somebody to the family, you're most likely going to have to add them to that same enrollment. So Henny has these guides, and they're certainly available for you. So as you look at this, so if in the scenario where you've realized that, uh-oh, I should have 3 people here with this head of household. I forgot to add somebody, okay? Not a problem. It's fixable and solvable, and the steps to do that are going to be here. So here's a scenario. If the member's not listed with the family, then you need to add the person to the family first, and then you can add them to the enrollment. So this is our example below. You've looked, you don't see the family member you expect to see. So you first need to add the child or other member to the family, and you can do this either from your dashboard that you have, or you can do it from the left side menu, okay? So from the dashboard, it's family members. From the left side menu, it's case management and family and contacts. First, we're gonna do that, okay? So case management, and I'm in the head of household record, always work from the head of household record, case management, family and contacts, okay? So from there, once we click on family and contacts, we let that load. You're going to click on the icon add family member spreadsheet. Okay, and that's right here, add the family member spreadsheet. All right, we'll let that load. And from there, you're just going to add row, and you're going to provide the information, and it's going to look very familiar because this table is identical to the add family member table that you saw during the enrollment. Okay, does the exact same thing. So you can see it's finding the head of household and 2 children. So let's say there's supposed to have been a 3rd child here. I'm going to click add row. All right, put in the name, test 7 and test 7, and then check for duplicates. Okay, and it's going to do the exact same thing that the enrollment screen did. It's going to go look to see if the client exists in the system, and it'll most likely find them. In this case, this is a test client, so it'll be a new client, but nonetheless, like I said, in 90+% of the circumstances, you're going to find the client, and then you're going to add their data. And let's make this person a little bit older. And just put the info in here. We'll say data not collected for SSN. And just do the, oh, sorry, I can't have more than so that's a child. Another key here is relation to head of household. Make sure that obviously you select the right one. It is changeable if you do select the wrong one, but always keep in mind you can always have only one self. So other than that, you can have as many of the other categories. There's no restrictions there. And that selection. And then you're done with this one and you can save. So you've just added another family member to the family. You can see here, you have this dashboard here. It's showing that you have the head of household and now the 3 children, okay? You'll also are gonna see the 3rd child listed under your family here, okay? So that's the first step. You've added them to the family. Now you can add them to the enrollment, okay? So as we did, we completed the form. This added them to the family. You see them in the left side menu now. You can now follow the steps on how to add the family member to the enrollment as you would most likely need to, because if you're adding them to the family at this point, it's the assumption is they need to be part of one or more of the enrollments that the head of household has been a part of, okay? So adding the family member to the enrollment, first the family member has to be part of the family, which we now know, and then you need to add the member to the enrollment. You just need to click on the project enrollment icon, and we're going to go through that here as well. Again, project enrollment icon can be done from your dashboard, or it can be done from your left side menu. So I'm going to jump over there, and we're going to do that now. We're going to go back to case management, go to project enrollment. And now you just have to know which enrollment you want to add them to. So in this case, I'm going to add them to this enrollment, click the gear, click member, okay? So we'll go back to the instructions so you can see that while that's loading. So from that left side menu, click case management and project enrollment. You're going to click the gear, you're going to click member, okay? And then you're going to click in the top right, the add edit members. Let's see if we're there, okay? So right here, this screen, this is the screen we're going to. We're going to add edit from here. What it's telling you is for this enrollment that we just clicked the gear on, there's 3 members. There's the head of household and 2 children. We want to add this 3rd child to this enrollment. You're going to add edit members. And there it'll show the child. Now again, this screen should also look familiar. This is identical to the program enrollment screen where you got to the program enrollment and it wanted you to check the members who are going to be involved in this enrollment. Okay, should default to that. And then whatever their date should be. Now, this might not be the same date as the program enrollment start date. Okay, this could be a circumstance where maybe it's not that you forgot to add this child, maybe this child joined the household at a later date. Okay, and that's perfectly fine. So in this case, we're going to say the child joined after they had a household. The child could have been in protective custody. Who knows where their scenario might have been? They could have been staying with another family member, and now, maybe the parent has secured an apartment, and so now they're cleared to have the child move back in with the household. So this date could be anything equal to the head of household enrollment start date or any date after that, assuming the enrollment hasn't been ended. And you can go ahead and say, oh, it's going to want that. And let's see, Mid-America, put that in and then save. Okay, so now we're seeing in this enrollment, we have all 3 children and the head of household, and you can just click done. So what we did is we just added, we added the child, that 3rd child, to this enrollment, okay? So if you were to go look at this one, you would see that there's only 2 children here because the other 2 children aren't part of that enrollment. And that may be true, that might be fine. But what you just saw was how to add a child to a family after the workflow, and then how to add that child to an existing enrollment. And if you needed to add them to this enrollment, the rules would be the same. You would click the gear, click member, click add row, and then check both of them, provide the dates, and you'd be done if that were the case. Okay, we're not going to add them here though. We're just going to leave them, the households, the way they were. Okay, so we've added the family members during the workflow. We've now added a member to a family, and we also added them to an enrollment. Okay, and that's all part of this workflow guide here, again, that you'll have available to you. The other thing you're going to need to do for these family members is you're going to need to create their assessments. Okay, so if you've added somebody to a household, and then you've added those people to the enrollment, there's no assessment data available for those 2 clients because they weren't enrolled during the workflow. So you're going to have to manually create those those entry assessments for those clients. Okay, so to do that, we're going to drop the family down, and we're going to see which client we want to start with. So this was that last client we added, so we're going to start with them. You're going to come here, and then you're going to go to either your HUD dashboard here, or you can also do it if you have it. See if you guys have it here on the left side. Oh, your assessments one. We call it program assessments. You have HUD assessments. So your HUD assessments are there as well. I'll just go right to here for that. So again, just because you've added them to the family, added them to the enrollment, you still then have to manually create the entry assessments for them. So from here, we'll go to HUD Universal and add row. And again, all of this is on the guide as well. Click no assessment selected. You're going to add the assessment. You're going to add the enrollment. Okay, whichever one makes sense. I'll just do this one because it's there. And then the assessment type would be entry, and then the entry date. This is the biggest step to remember, is make sure you put in the actual entry date because it will default to today's date. So whatever it was for that particular client, I think this one was 2022, was 131. And then just go ahead and hit save, and that will generate the entry assessment for that child, so you can supply the data. Then we'll just put no for here. You supply the data, you can hit save, and then you can move to the next assessment. Now, what you will notice is because we created that one assessment under Universal, when we go to do HUD program and add new, you're going to actually see that available and selectable under add new. And when you click on no assessment selected, it's going to be there for you. So you don't have to add a new one here. You just have to select that one. Okay. So just make sure you're aware of that, that it's going to, once it generates it once for you, it's going to be there for you to retrieve and then you can just supply the data, okay? So again, all that, those adding the assessments to those workflows for those clients, how to do that, that's all listed out here in the guide as well. So then, as you go through each record, you can complete the assessments for these new clients that you've added to the household and to the enrollment outside of the workflow, okay? So from there, the next one now, the next item that has come up is exiting a family from an enrollment and not subsequently ending the enrollment for everybody else. Very common problem, very common question. Again, you're in good company when people get confused by this process. And we did also provide the guide for that. And here we have exiting a family member from an enrollment. Let me zoom in for you a little bit. So you can do it again, either from the dashboard, project enrollment, or from case management, project enrollment. You're going to click the gear and you're going to select member again. You're going to find the person you want to exit, and then you're going to do complete exit assessments. So we're going to go ahead and take that step. And what it's going to do from there is it's going to bring you through each of the assessments that you need to complete in order to exit that family, or that family member rather. So you can do this again from the Hud household. That's fine. And you're going to go to project enrollment. Let's click the gear on the household we want to remove the family member. Okay, so again, we are on this gear. We're going to click member. Now we're going to find the member we want to exit. And while that pulls up, I'm going to bring this back up because I do want to point one thing out. Is notice where this arrow is pointing. It's click on the name of the person. Okay, this is where people get tripped up. They look on this screen and it's not overtly apparent that the mechanism to start this exiting member workflow is by clicking on the name. Okay, a lot of people come over here and they want to do things, but really it just exists here. So let's say we'll pick on this child. We're going to have this child removed. We're going to click on the name. See if it's going to work for me, or do I have to add it? Oh, so I got to add it first. Sorry. And then it'll let me click on the name. Oh, it didn't. Why didn't it let me click on that name? Hold on, that should have been clickable. Either that or I went too quick for it. Why is it it's not clicking for me? Because that should be, to exit them, it should be clickable. It might be because I'm in pending status. Let me pull up another test that's complete. And we'll do that, 714538. Might not like it because it's not complete. So, but it's probably not liking the fact that the assessments are in pending. At least it should. Hopefully, nothing is broken on that. Oh, that enrollment go away. It did. That enrollment's gone. Are they not enrolled? Oh, there we go. Oh, that one's in pending. Let's see. Let's see if it happens under here as well. Otherwise, I'll just have to quickly complete that. But it shouldn't care. Yeah. That's not. It shouldn't care that that is not done. All right. So let me do this quickly. Right. I'm just going to complete this for this person. And for the child. So this is going to take me through the child records as well. So it shouldn't cause a problem when we go to edit the member.
just for everyone in the call, it is clickable, I think. So I tried it on our trainer environment. We have
Okay.
another comment in the chat that they tried it in production and it's working. So I think it's because the assessments weren't created, but you should be able to click and select an exit workflow from the client individually.
Yeah. It's probably the only reason it cared was because I left those in pending. Real quick and get these done. Because I was pretty sure I had tested it without completing the enrollments. That's why I left them in pending, because it didn't cause a problem. But then we'll have complete households to deal with, so should not cause a problem going forward. Almost there. This will be the last assessment. I feel like having the bird hop around actually slows the screen down. There we go. Leave all this as no. Okay. And we don't need any services yet. Oh, got choked up, but it looks like it finished most of them, so we should be. Hopefully it set it to enrolled. If not, I can force it to enrolled. Let's do this real quick. Can probably make it enrolled this way. See if it is okay with that. You all don't have that screen, so don't be surprised that you haven't seen it before. Yeah, okay. Did it that way. All right. So now let's see if it will let me do that. Where's my case manager? Without too much trouble. All right. See if that's going to be clickable. There we go. Okay. So now from here, we can complete the exit assessment. So just another note, if you have assessments in pending status, you certainly won't be able to do this. So from here, you can click complete exit assessment for this particular family member. Again, we're not removing them from the family here. We're just removing this single member from the enrollment, okay? Now, I'm just gonna go back a screen just to talk for a second. A lot of times what people will do is they'll come here and they'll try to do the full exit. And they're exiting the entire enrollment. The structure here is this. This is not the an enrollment associated with a person at this level. This level is the household enrollment. And that's just something that if people understand, then they'll understand why there's two layers to this. There's the household level, which is what you see when you click case management, project enrollment, or from your dashboard, zoom in a little bit, from your dashboard project enrollment. It's bringing you to the household enrollment, all right? To deal with individual member level data, where it's just you want to remove a single person, you have to go to the gear and then member. This table is showing you the individual members' enrollment information, which may be the same or different than the head of household. Okay, so that's just the distinction there, and if you can internalize that, it'll make the remembering the process that much easier. That to not reflexively just go project enrollment, click the gear, and exit, because hopefully you'll have that moment of, oh, wait a minute, this is the entire household's enrollment, not just my one client. So from here is why you want to do the complete exit assessment for the individual. And then it'll launch the workflow. And from, I'm going to say no, you can copy if there, but this is a test client. So I haven't created anything really for them to copy. So I'm just going to say no in this case. But if you say yes, it will retrieve the historic data that a client may have in the system that you can copy from entry to exit. But in this case, I'm just going to say no there. So this will launch the workflow. And for HUD Universal, and Henny, I was actually going to mention this because I did see this when I was doing an exit. Just might want to check to see if HUD Universal is listed in the exit workflow under assessments for project setup, because there are no questions at exit for HUD Universal. So when you get this screen, you're actually just going to save past it. And then the next one will be the HUD program assessment. One thing I want to point out as well is because we're exiting an individual from the household, it's going to default to today's date up here, 2/8/2022. But let's say that you're doing this on, it was really the person left on 2/6. That's fine. You can edit this. We're in this HP enrollment, so I'm going to find it here. And this is the exit one here that I've just started. I'm going to click edit, and you can change this date to 2/6. You just got to put in the hashes. They don't put in the input for that. So you can certainly do that here, and it'll let you know that it updated the date successfully, and it should go ahead and honor that date, which it has. Okay, and then you can go ahead and complete the exit. Okay, and that will exit the person. Actually, I'll save that progress there. That'll exit the person from the household. Okay. So now, when you go look at the member settings, you'll see when you complete it, this person will have an exit date on their member enrollment. I wasn't going to go through the whole workflow because obviously we spent time going through that with the other ones. But so this is where the exit will show up. The client will still show up here. Okay, you haven't removed them from the family list. You've just removed them from the enrollment. So their end date will show here, and they'll be exited from the enrollment. So if you run a report, you'll see them as somebody who has left the program. And from there, if for some reason, if they re-enter somewhere else, you can always re-enroll them, or if they go to a different program somewhere, you can re-enroll them there, but they'll have been exited from this particular enrollment. Okay. Again, the distinction here is a lot of times we get tickets where somebody says, oh, I exited my client, but they're still showing under the left side menu. That's because this is the member, the family member list, not the enrollment member list, okay? So the enrollment is still going to show as open here because this is the household level. The member level is where you're going to see the exit date, okay? All right, so from there, again, we went through all, these are adding, here's exiting. we've gone through, you've done complete exit, you've gone through the HUD program, HUD financial, HUD health insurance, all those assessments. You've put in the correct date. Next, you'll just check the member status. As we said, you would just go back to member and click the gear and select the member, and you'll see, again, your member will have an exit date on their record. I just didn't go through the whole exit just to spare you all having me go through those assessment questions, okay? Now, if you want to, yes, go ahead.
Oh, sorry, we can scroll up a little bit. We had a question about the HUD
Yeah.
Universal date, and I think the page before this, maybe before that one.
Yeah.
I saw, so right here, after step 8, a little bit below that. So the exit assessment date, and Rachel, I hope you can hear us. So when you're doing when you exit a member individually, I know the date might look wrong because it defaults to today, but at the end of the assessment, you're able to enter the actual exit date, and that's what's going to change the date of all of them. So you won't need to go back and edit that.
Yeah.
You'll be able to enter it at the end of the workflow.
Yeah, you could. Yes, there will be at the end of the workflow. There is that exit date table, that program enrollment exit table, where there's going to be an exit date field, and you can put the exit date in there as well. But certainly, you can edit the exit date right when the assessment launches. Also, the other place you can do it is if for some reason you realize that you missed a step with the date, or you forgot to change the date in any of the assessments. You can go to Assessments, HUD Assessments Dashboard, and you can certainly, as we talked about, edit the date from here as well. Just click on it, and then whichever one you want to edit, you can just come here and you can edit, and you can change dates here by hitting the drop down and clicking the pencil and edit as well. So that's one nice thing about Caseworthy, is just about everything can be edited or fixed. Whether it's again, the program enrollment start date, program enrollment end date, family member stuff, whatever it might be, it's all stuff that can be addressed by the end user in most scenarios. So, okay. So we talked about editing the enrollment for the family member. Now, again, when we talk about exiting somebody from the family, let me just get through. You don't have to exit somebody, the family member from the household. It's one of those things where, and this is one of the ones Hanny and I were talking about, and that's this last guide. So you've exited them from the enrollment, and they're still showing as under the family. This data, this list, isn't impacting anything. It's not impacting any reports. All the reports are built off of the enrollment and the assessments. So if the person has been exited from this particular program enrollment, the system is going to know that their exit date will follow them, their data will follow them to whatever reports you run, whether it's an APR or your path report or whatever it might be. So you don't have to remove them here. But if if the person has started a new enrollment, so they left the household and they are now starting their own enrollment either in your program or in another program, there are a couple different ways to do it. If they're starting an enrollment in a different program, you would want to, that enrollment you would want to create first, so it creates their own family and household. And then at that point, if you want to come back and exit them from the family, you can do that. But it does, as Hanid has talked about, it does create an orphaned client scenario if you exit somebody from a family without them having another family ID in the system. The system requires that the client record have a family ID associated with it, and if it doesn't, then it becomes an orphaned record, and it could create the client to be no longer visible. But if you have the client, they've left the household, they've moved into another apartment or another program, they're being served at a different program, that enrollment's been created, you see that they have that enrollment created, and you no longer want them showing here for whatever reason, you just don't want them in the household, you can certainly remove them from the household. But just know that, again, if they don't have that other family enrollment, then you are going to have a client that will no longer be searchable if they are not associated with a family. So we have that guide as well. There is a feature, a workflow that can add or create a new family. I will work through that feature and put a guide together for that one as well. So you do have it. I just want to test it to make sure it works. It's one of it's one of the case-worthy sort of nuances. They have a lot of tools, but we always want to check the tool first to make sure it does what we expect it to before we have the end user use it. But to remove somebody, if you wanted to end their family member history or end their family member entry, from there, it's case management, family and contacts, and then actually that's still a little small, move up. And then the family icon. So from the left side menu, case management, family and contacts. And this table always takes a second to load. And then family. So that's that icon I showed here. So again, that's that one. I know it's a little hard to see. And then you're going to edit family members, not remove and exit or anything like that, just edit family. Okay. And then you can see that you're going to be from the top right again. That's a little small. I apologize on the guide. Let's see. And then you're going to do the add edit family. That's up here on the right, or add family member. There we go. That's the add family member. I'm sorry. You're going to, where is it? Edit members. Then you can just, I believe it's off the check. Let's say we're going to end this one. So here you can put in the end date for the particular family member. Now remember, if I put this date in, and the client doesn't have any other enrollments or any other families they're associated with, they are going to disappear. If that will slide over, no one. They're going to disappear from my left side menu under the family list, but they're also no longer going to be searchable. So I'm not going to do that. I'm just going to show you that you can certainly put in the date here, whatever the date happens to be. About today's date, I'll just use. So I can do that and save it, and that will remove the person from this family. But again, I hazard that you do that unless you know that person's part of another family, and you'll certainly want to touch base with your support, whether it's Hanid, to make sure that you do that correctly. Because again, there's no requirement that just because a client has left an enrollment that you have to remove them from the family. HUD allows client history to be in more than one family. That's why the system is set up that way. Most HMIS platforms are set up that way, where a person can be in more than one family. You don't have to do anything special if the client is no longer part of your particular enrollment. So again, under so we'll look at this one really quick. So let's say, for example, you've exited this particular client from this enrollment. And they're going to enroll elsewhere, that's okay. It's wherever they enroll elsewhere, that family member screen, that one where you add the members to the household, is always going to pop up. So that person can be added to that household. They can be added to 3 or 4 different households. So again, the point being is there's no requirement that just because they've left that particular enrollment that they have to be removed from here as well. If you want them removed, again, for just the visual aspect of it, that's fine, but I would make sure you get support on that to make sure that they have another enrollment or they're associated with another family before you do that. Okay. Any question on those items?
We have a
That
couple of
covers.
questions, Jim.
Yeah.
One, I was just clarifying. I think we both answered it. You, me in the chat, and you out loud about reports will only show the members that are part of the enrollment, not part of the household.
Yeah.
Which is, I think, one of the things that kind of, like you said, the visual part kind of gets confusing because you visually see them as part of the household, but not the enrollment. So just clarifying that. And then earlier we had a question about what is the difference between add family member workflow and add family member spreadsheet. And that was, I think a few examples ago, I think one of the family screens.
Yeah, let me go. So I don't remember which was, so we hit the family was all right, well, so for the add family member workflow actually takes you through will take you through the enrollment workflow. So it depends on whether you're talking about adding the member to a family or adding somebody to an existing enrollment. And I thought I had a screenshot of it on one of these. Was it this one? Zoom in a little bit. Let's see if we can get there. The member. That's the assessments. Adding a family member. Was it here? That's during the enrollment. I have to, but again, let's see if we can get family and contacts. So yeah, when anywhere you see the enrollment, then it should be launching, or the workflow rather should be launching the assessment questions, and the other is just usually a simple. As soon as the screen catches up here, little birds bouncing around. There we go. So yeah, added the family member workflow. We can just go ahead and click on that. Anywhere time you see the word workflow it's going to give you a workflow that's associated to that particular program if it's launching properly. And I just might not be on a valid client. Yeah. And then the add family member that we did, the step that I did was to get it so you can, the feature that I know works best is to add the person to the family, then add them to the enrollment. And where was it? Quick add family, edit family. So, there's a couple different tools there that Caseworthy has. And that's why I created the guide for you, because it's best if you follow those guides because you're going to find a lot of different named tools. So they'll do different things, but that's, use the guides to work through adding a person to a family, adding a person to an enrollment, and creating the assessments. Because again, I just find that there's certain tools that again don't always behave the way that we expect them to. All right, any other question? And there's the spreadsheet as well as that one. That's what I was trying to get back to. There we go. And so again, this is the one where it resembles the enrollment screen. So when you're doing the enrollment that we did initially, this is the screen that resembles adding the family member to the family. It resembles that step in the workflow. So again, that's when you just click add row, that's why it looks identical to the enrollment screen when you're doing an enrollment, and you can add them here. So again, I would recommend when you're adding a family member that's the option you choose versus add family member workflow. Okay. And then certainly once you've added them, then that's where you'll go in and you'll be able to do you'll be able to enroll, start the enrollment for that person once you've added them. Is that it? I don't know if you're muted, Henny.
Oh, hey, Jim.
Oh,
Yeah, as I was reading another question in the chat about so if a couple separates and only one person is receiving services in the household, do we remove the adult from the household even if they're not going into another family household, or even if the adult child moves out?
All right, so let me make sure I absorb that. So you have a household, and what's the first step? So who moved out?
So let's say that the partner
Mm-hmm.
moves away from the household and they're
Okay.
not going to be a family anymore.
Mm-hmm. Right. So again, all you would have to do is exit that partner's enrollment by using the steps from the guide. Go to the member and find the family member you want to exit, and simply exit them. That exits them from the enrollment. Now, just know that if your desire is to remove them from this family list, you will again create that orphaned record scenario if they don't already have a um, if they don't already have another enrollment. So that's just the only hazard there, is that if you're going to then remove them from the family, because you don't want to see them under the family list, um, I would just say you may want to have a discussion about that and make sure that this particular client does have some other history in the system. Now, if the person is being enrolled in another program, so they're exiting this program enrollment. So they're going to exit this program enrollment and they're going to have a new program enrollment started. Well, then you can exit them from this enrollment, create the new program enrollment as this person under their own family. And once you've created that new program enrollment and they have their own family ID, then you can go ahead and remove them from this family. That's fine. That won't create the orphan scenario. But that's just the hazard, is if you really want somebody off this list because they've exited your program, again, just make sure they exist somewhere else in the system under either another enrollment or another family ID.
All right. Thank you, Jim.
Mm-hmm. Okay. Should we move on to?
Sounds good. Any other questions
Okay.
in the chat? I don't think we've seen anything pop up except that one,
Okay.
so I think we're good to continue.
All right. Yeah. Okay. And I'm not going to use the actual slideshow because it'll screw up my two screens. So I'm just going to do it from here, from the edit. So editing data, the program enrollment date was one of the items that, let me go back to the agenda real quick. So program date, member date, assessment date, copy edit assessment, those items. So as we talked about earlier, and it sounds like a few of you are pretty familiar too with editing dates and things like that. The program enrollment edit, there's obviously there's the enrollment itself, but then there's also the member enrollment. So we'll talk about those two things again, keeping in mind the dynamic of when you find a client, and let's say in this case, it's the head of household. The program enrollment that you're seeing is the household enrollment. If there's more than one person and you need to edit something that's involved with just that client, so you just need to edit something with the child, not the head of household, make sure if you need to edit a date, you go into the member screen, not the top level, which is the household screen, because you can edit everything from here. You can edit the individual records from here, right? Just by clicking that, and you can edit an end date or edit a start date, whatever it might be, okay? But to edit the enrollment start date, the household enrollment, which is one of the items, again, just click the gear and click edit, and you can edit the enrollment start date. Now, I will say this program enrollment start date is 1/15/2022. Let's say that you thought that should have been 1/1/2022. Take note that this enrollment started on 1/15. So most likely the head of household's member start date is also 1/15/2022. So why I talk about that is what you don't want to have is a scenario where the overall household start date is different than the head of household start date. At the very least, you don't want it to be later than. So what I'm talking about there is, so let's say we want to change this to 1/1/2022. And this is the head of household, this is the household start date. We've just added or edited to 1/1/2022. Then you go and look at the member date. The member date is 1/15 for everybody except for this person who started on 131. You really, if the head of household started this enrollment on 1/1, then you're going to want to edit their start date as well, at the very least, the head of household start date. You're going to want that to be in line with the household enrollment start date. So just make sure those two dates are in line with each other, because I have seen where the head of household start date is when it's different than the household, the overall enrollment start date, it can cause problems. So you would just want to come here and then just at the very least edit the head of household as well. Because most likely if the program enrollment started on 1/1, then the head of household enrollment started on 1/1. Because again, we're not talking about move-in date here. This is the enrollment start date and the member start date. Move-in, as most of you are familiar with, is a totally different animal. And we're going to talk about that as well. But move-in date is when the person occupied the unit, as we have for this rapid rehousing enrollment. That date field can be equal to or greater than the enrollment start date. It can just never be less than. So again, there's some nuance there. You have the overall program enrollment start date of 1/1. Then you have the individual member start dates, where you want to make sure that the head of household is in line with the overall program enrollment, because most likely when the head of household started in the program, that's when the enrollment start date happened. Okay, so I have the screenshots in the PowerPoint on how to edit those dates for the enrollment. The next one is the member date, which we just talked about. Again, where to go to do that. There's the you're going to want to make sure, again, as I said, that those dates are in line. So you'll also need to edit the member date if the member start date was the same as the enrollment start. You don't want the member start to be dated after the enrollment start, so on and so forth. There's a couple ways to edit member. I have one of those ways there. And certainly we just walked through how to edit just going through the program enrollment method as well, which was here. Assessment dates, we talked a little bit about when we did an enrollment to do the HUD assessment dates, any of them, or any assessment date for that matter. I have the screenshots there. But as you know, just what we looked at before, either from your dashboard or from assessments, HUD assessment, you all saw, again, when we went through that on how to edit that. I won't belabor there because, again, it sounded like people had a good grasp of coming here and going to the edit field and making those changes this way. And you do have the slides there. This is one of those things, editing the assessments, people tend to have a pretty good grasp on because it's something they've had to do periodically, whether it was for an annual assessment that wasn't dated correctly or an exit or entry assessment that they needed to adjust. But certainly if somebody wants to see that again, let me know because I can run through it again. But since we did look at it a couple times, I don't want to waste too much time on that. The other is the copying and editing. And there was that copy feature that came up when we were doing an assessment, and when you're doing an enrollment, as you're enrolling a client, the copy previous will launch, and if there is data to be found, you can copy that assessment. Let's see if we I'm not going to jump through that, but because again, I can provide, if people need that, if people want to see how that copy assessment works, we can provide the screenshots for that as well. But again, that one is the copy previous feature will pop up, and you can certainly do that. Again, from what I see is that people do tend to have a pretty good grasp of that. I know there was some more, I think, pressing items. And Hanny, correct me if I'm wrong, but I know from what I understood, things like, date of engagement movement. I just want to be conscious of people's time as I'm looking at it. We're past one now. Is there, of the stuff I've already covered, is there anything that needs to be recovered? Or do you have questions about some of these items before I move on to the next group of items that we have on the agenda?
And just asking the group if you are okay with that, any thumbs up or comments in the chat, unmuting yourselves. If it's okay to move forward, we have a thumbs up. Or if there's anything that we need to go back to review that wasn't clear, we're getting thumbs up, Jim.
Okay, yeah, that's what I figured. Is again, the editing the dates. It's really the big ones are program date and member date, but then like assessment, copy assessment, people tend to have a good grasp on. And obviously, all these items that we talked about earlier are probably the bigger lift, the bigger issue that people run into. And then of course, this last section where we talk about move-in date, date of engagement, and the current living situation assessment for outreach. I just wanted to make sure we had a good amount of time for these because though they are not, their size, I guess, the space they occupy in the system is very small, but their impact is obviously large. So I did want to make sure we had time to cover those, and that's what we'll jump into now. And we get into our one-time fields and things like that. Okay. So the one-time fields and vital assessments, move-in date. Obviously, move-in date is required for rapid housing and PSH program enrollments. And obviously, the person has to occupy the unit. Now, where there's a lot of confusion with this, when we talk about move-in date, the reflex a lot of times, especially whether it's PSH or rapid housing, is to make the move-in date equal to the enrollment start date. And that may or may not be true. HUD allows for the move-in date to be equal to or greater than the project start date. And there's obvious reasons for that because rapid rehousing programs can start engaging a household while they're still in shelter, while they're still on the street. And HUD wants that enrollment to start when that date of engagement starts. So if you're a rapid rehousing program and you've started to communicate with a client who's living in shelter, they want that program enrollment start date to be when that relationship begins. And then whenever that person occupies the rapid rehousing unit, that's when HUD wants the move-in date, which is why they allow it to be different, just not less than the enrollment start date. So there's also circumstances where a move-in date never happens. That's also allowable, rare, but allowable, where a rapid rehousing program, for example, starts working with a household, and that household, for whatever reason, after a certain period of time, disengages from service. And now you have a rapid rehousing enrollment that's exited and there's no move-in date. So it looks uncomfortable on an APR, and it looks uncomfortable on evaluation of data where you have, a household with no move-in date and they had an enrollment that was open for 6 months. But it is a circumstance that can occur. So with move-in date, again, the key here is that if the person never occupies the unit, then move-in date stays blank. Move-in date gets filled in when the household or family or individual occupies the unit or takes lease of the, they sign the lease and they take over the unit. So I just want to make sure that's clear. Now, the other thing, and we've talked about this in the high impact assessment arena with move-in date has implications across the system when it comes to APRs, system performance measures report to HUD, and the longitudinal analysis that goes to HUD as well, the LSA report. Move-in date is what stops the homeless clock counter. And those of you who've either seen or seen the PowerPoints for the high impact assessments have heard this discussion before. So if you have a household who has a homeless history, so let's say the person was in an emergency shelter, they have an emergency shelter enrollment prior to coming to your rapid rehousing program, the system is going to count that person as homeless for as long as their enrollment goes without a move-in date. So from the date they were entered into the emergency shelter program, 1/1/2022, to the date that they get a move-in date in a rapid rehousing or PH program, they're going to be continually to be counted as homeless. Now, the other date that gets looked at is the approximate date homelessness started. So if a client has in the HUD Universal Assessment approximate date homeless started of October 1, 2021, same rules apply. From that emergency shelter enrollment until a move-in date is supplied, that person or that household will be counted as homeless. All those days will count as homeless days. So that's where this one feature, this one button, becomes abundantly important across not only your agency, but across your community's data as a whole. So it's extremely important that the move-in date field, if the person does occupy the unit, and I'm not going to wait for this thing, I have a screenshot of it. I'm not going to wait for that little bird to get to it. If the person has occupied the unit, just make sure to provide the move-in date as soon as that happens with the date that it occurred. Okay. All right. So then we talked about that. So the nuances of it can be same or equal to or greater than, and again, where it can also be blank. The one-time fields, more one-time fields, the date of contact and date of engagement. Okay, I did provide quite a bit of information here because HUD provides quite a bit of information when they talk about date of contact and date of engagement. Okay, so for emergency shelters and street outreach programs, these are the programs we're dealing with. So date of contact, when that's talked about, it's talking about the number of persons contacted in a period of time, which equates to that current living situation assessment. And for those of you who don't deal with, that thing's still bouncing around there. For those of you who don't deal with emergency shelter, or I'm sorry, street outreach programs rather, that current living situation assessment might be something new to you. So what this is for outreach programs, the HUD wants to know every time you contact the client, what is their current status? What is their current living situation assessment? And essentially what they want to know is for, again, if we had an SO street outreach program here, we would select it. But they want to know where was that person when you contacted them? Were they on the street? Were they in shelter? Were they in housing? Were they in jail, prison, wherever it might be? You provide that data, you provide the date that you did it, and you provide the type of service that you were executing when you met with that person, and you save it. And that creates the current living situation assessment, which then generates the contact. Okay. So in the APR, we're looking at Q9A, table Q9A. It reports the number of persons contacted, how many times they were contacted, and if that location was street or other. On that table, those of you who run the APR, this information will be helpful for you to look at if you want to understand that table. It tells you, what it's referencing for current living situation, and then HUD's rule on current living situation. So again, here's the rule, the purpose of it, to record each contact with people experiencing homelessness by street outreach and other service projects, and to provide information on the number of contacts and documenting where that person was, what their living situation was at that contact. Record the date, obviously, the location. You saw the assessment, so that's why the assessment looks the way it does, is because here's HUD's description of what they want to see. They want to see the date that the service happened. They want to see the location of where the person was and the service that was provided. And then all street outreach projects are expected to record every contact made with each client by recording that current living situation assessment. Okay, so that's date of contact and how it translates to current living situation by that assessment. So again, for outreach, emergency shelter projects like that, those are the ones who are generally doing that. Now, date of engagement. Okay, again, it is a feature that is associated with the outreach or the ES programs. And Q9B on the APR, it's a report of all persons contacted that have a date of engagement supplied. It's recorded based upon how many times they were contacted, and so on and so forth. Again, this will be part of the PowerPoint, so you have it. There is a rate that's included, so a rate of contacts if you really want to dissect that table on the APR. Most important thing being the HUD guidance on date of engagement is it's the date that the client became engaged. And understanding this definition is important, which is why I put it there. And this can be applied to all projects when you talk about when a client is engaged in service. So after one or more contacts, again, they talk about this with emergency shelter and outreach, night-by-night shelter and outreach, record the date that the client became engaged in services. So why I say that can be thought of as a general statement is especially when we're talking about the difference between project start and move-in date. If you think about when you engaged the household, when they became engaged in services, you can also use these rules from HUD to determine what that date should be. So it's the date they became engaged in services where development of some type of plan, or whether it's a treatment plan or housing plan, they've signed some documents, things like that. These are behaviors that would initiate or would create what would be called a date of engagement. So you could, it's obviously for street outreach and the night by night shelter setup. This is what they mean by date of engagement, but again, it can also translate across other project types. When we talk about the enrollment start date versus the housing move-in date, you can think of that enrollment start date as the date that the household engaged in services or started to receive services from your rapid rehousing program. So again, it's more than just the definition applies to more than just these particular project types. All right. So the one-time fields that are associated with this, the date of engagement field is on the project enrollment. I had the family name for you there. And it's called one-time field, similar to what you would see with the move-in date. And its structure is the same. It provides a date of engagement similar to what move-in date does, and that again is that date that the household became engaged in services. The next one being that date of contact that we had talked about first. You have the current living situation assessment, which is here, which we looked at, but I provided the screenshots for that as well. And you can see the off of case management, current living, and then add new, and you get the current living situation assessment. All right. So those are the vital pieces of information for things like move-in date, date of engagement, and the current living situation assessment. Are there any questions? I'm not sure if we have any street outreach projects on the call or emergency shelter projects on the call, but nonetheless, there is obviously translation when it comes to date of engagement for rapid rehousing, and obviously move-in date translates to all PH projects as well.
And yes, we do. We have both street outreach and emergency shelter here today, good, as well as other groups.
Okay, so that's good. So yeah, street outreach, and you don't have any PATH funded outreach, correct?
Correct. We do not have any PATH outreach.
Well, that's lucky. That's because that does add a nuance and really emphasizes the current living situation as well for PATH. So that's those are all the slides for the presentation and as well as the guides to. We got a little bit of time. I didn't know if people wanted to go back and see something again or walk through something again. We could do that.
Thanks, Jim. And just folks on the call, if there's something that you need to, if you want to type in the chat, if something we want to go over, something that we wanted to clarify or just review one more time with the rest of the group, if you want to either unmute yourself or type it in the chat. And if you don't feel comfortable in the chat, you can also send me a direct message anonymously, and I can ask it on your behalf. I'm just giving a few folks a few minutes to type if they're making up stuff. All right, so I'm not seeing any questions in the chat or to myself. I don't think anyone's unmuted themselves either. Or maybe I do see someone unmuted themselves. Okay, no, I think they don't have audio. Sorry. Yeah, it sounds like we don't have any other questions, no hand raises, or if you want to give us thumbs up saying that you're okay with wrapping up, that would be helpful too. All right, we got a thumbs up. Thank you for that. All right, we have more thumbs up. Thank you, we appreciate that. Jim, well, thank you so much for being with us today. I know we have your slideshow, we recorded this session. We also have the guides that you reviewed today, which are very helpful, and we can share that with the rest of the group. Again, if there's any follow-up questions, please let us know. Of course, my dog decided to bark as I unmuted myself because it's what he does. But anyway, if you have any questions after this training, please reach out to us. We will be sending you the documents for today, as well as a survey. You can take 5 minutes to do that. It will be completely anonymous, but we appreciate your feedback. And we also appreciate you taking the time for being here today. All right. Thanks so much, Jim.